Good day, everybody. This is Chris with the Ancient Scholar. I wanted to do a quick point of clarification on high pressure nervous syndrome or high pressure neurological syndrome video I just posted. Uh, and there's kind of a bit of a misstatement, if you will, in that video where I talked about high pressure neurological syndrome not really producing um, pronounced changes in mental status, or something to that effect, and that statement isn't entirely correct. And so what I was attempting to articulate in that was that the primary signs and symptoms that we see, or at least initially, are this neuromuscular irritability, these tremors. But in the less acute situation where somebody is maybe in this high pressure environment breathing heliox for extended periods of time, or if they continue going deeper and the pressure increases, you will have potentially changes in the neurological status or the mental status of the patient or the person in question. They can have irritability. They can have problems sleeping. There's actually been some sleep studies that have been done on patients breathing heliox, and there seems to be some disturbances with polysomnographic studies. In addition to that, you can have behavioral changes that can occur as well. In fact, this was used as a plot point for a movie that was it's about 20 plus years old by now. It was a movie called The Abyss. It was a James Cameron movie, and one of the people in that movie ends up developing high pressure neurological syndrome, according to the plot of this movie, and he actually um, gets very paranoid and ends up engaging in some very savory behavior as a result of this HPNS. That's um, obviously kind of a fictional plot point, but the fact remains that high pressure neurological syndrome can absolutely manifest with mental status changes. And I apologize if what I said in my first video was at all confusing. It's just that the primary things that we see are these tremors, and then as the syndrome progresses or gets worse, you then start having these mental status changes, and that can progress even to seizures. So this can be completely incapacitating and or life threatening in severe manifestations or severe cases of it. So hopefully that cleared up any questions anybody has. So thank you all so much. Take care, and we'll see you in the next video.